On Monday, the Higher Education and Training HIV-Aids program launched a new survey focusing on the LGBTI community in the higher education sector. They highlighted a casual attitude in how HIV-AIDS is tackled at higher education institutions in the country. While the government is doing its part, it appears as if individuals are showing indifference to issues of HIV and AIDS. Well, we're joined in the studio by the HEAIDS Program Director, Dr Ramneek Ahluwalia, to tell us more about the survey. Good to have you. Thank you very much for coming into the program.
Thanks, Leon. Thanks very much.
I believe this is the first report of its kind. And what prompted this report?
I think this is the first of its kind in higher education, specifically towards the lesbian, gay, bisexual, transgender, intersexual, the LGBTI community, and specifically targeting the men having sex with men. We all know science has proven that the men having sex with men have 4 times more risk of HIV than the non-MSM population. And when I started in 2011 and I traveled around all the campuses, and just to remind the viewers that we've got 430 campuses of post-school education system with young people. Yeah. And we found out that as much as stigma remains the biggest driver for this HIV, and we're fighting this population is more stigmatized. So we are battling another stigma, first of all, to get this important population to be graduate, to be living, and second important thing is that they are much more high risk to HIV. And I think that prompted us to conduct the survey, get evidence, so that from now on we can implement programs as much as we implement programs towards men empowerment, women empowerment, first things first, alcohol and drugs. I think this is an important area as a key population to focus on.
Yeah, most definitely. But let's delve into the survey a little bit and talk about some of the findings. What would you say were really sort of some of the glaring findings from it?
I think there are alarming findings, and I will reveal, but on the other side, Leanne, there are some positive findings. And I think when I say the positive findings, as a nation, we are proud that we are making strides in the epidemic of HIV, and this survey does give us that kind of little information. But on the alarming side, it has come out from the survey, which is for me was a question to note, was that this population is actually not homogeneous. That things we call they are homosexuals or they are homogeneous is not true, because about 50% of them upfront and said they also had once a bisexual partner or a woman as a partner in their lifetime. And I think that came up as a very strong finding. Half of them abused drugs and alcohol. Yeah. And this is more than the non-MSM population. And for me, that was a very alarm, because as much as we know these are young people, but drugs and alcohol disinhibit whether they use condom at their last sex and issues on those grounds. So I think that was very worrying. Yeah. My another bigger was that they're more prone to change partners. About 71.9% are more likely to go into concurrent partnerships with other than a primary partner. For me, that is a worry sign. As much as we know that higher education or universities and colleges are prone for transactional sex, concurrent partnerships, but such findings are giving us an indication towards more interventions that needs to be protecting them. Yeah. Stigma and discrimination, yes, they are literally very highly stigmatized. They are very hidden. And that is where as a selfish interest of higher education will be, or the minister's interest will be, or department's interest will be, is to get competent graduates out of them. A throughput should increase. Yeah. And we have a very low throughput. So I think that's where it's moving towards.
I want to talk about this alarming figure where it shows, or the study shows, and I know you mentioned it briefly, but I'd like to delve deeper, that more than 36% of student MSM, now you call it MSM, that's men having sex with other men, use condoms inconsistently or not at all. And in this day and age, one would think that with the fear of HIV and AIDS and all of the education and everything we've been confronted with, this would be something that we wouldn't even need to worry about. And yet, it is still a major issue. What more needs to be done? I mean, from my perspective, it looks like government education drives are doing the best they can, but it doesn't seem to be reaching the right markets.
It's much better than the results that we had in 2008 and 9, to be honest. I mean, for me, it's still an increase of the condom usage, but you're right. Till we don't reach the 99% targets, it's absolutely a failure, because students are not using condoms. Yeah. I think there has been a start through the First Things First program, when the Minister of Health actually launched with our Minister and that was the colored and scented condoms. And I think to improve that readily available government condoms, if they are scented, they are colored, probably might support these young people getting into. Mind that the study was done in 2014, and the launch of these colored and scented condoms for the first time in South Africa happened only in 2015. We still need to wait and watch whether this will really make that impact. Other thing is that we need to continuously raise awareness. Education remains still the key idea. Yeah. Alcohol and drugs, the biggest thing is if 50% of students are abusing alcohol and about 23% openly declare that they abuse alcohol before having sex, that is absolutely an indication that they're going to use condoms, because that disinhibit using condoms. So I think there are more determinants before condom usage comes that we need to tackle. So disease is HIV, but surrounding a disease, there are so many determinants, so many factors that needs to be tackled before an HIV can come in the picture.
Just very quickly, I've run out of time, but I need to ask this question. Is there a difference between the community, the LGBTI community that you did the survey on, and your heterosexual students when it comes to condom usage? Is it very similar, or is there a difference?
Not much. To be honest, it's almost similar.
It's almost the same.
The same study that indicated that among the heterosexual population, the awareness and everything remains the same in the men having sex with men. Yes, slightly with a few 3, 4, 5% difference. Men having sex with men are less using condom compared to the heterosexuals. Yes.
And it shows, listening to some of these students talk, they're more worried about falling pregnant than they are about contracting diseases.
Absolutely, dear.
All right, let's leave it there for now. Thank you for talking to us about the survey. A survey, it's quite an alarming survey actually. Dr Ramneek Ahluwalia from HEAIDS, looking at the habits of the LGBTI community in tertiary education. All right, let's take a break. We'll see you after this.